This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Monday, July 13th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate your staying with us on Africa 54. Zindzi Mandela, daughter of former South African President Nelson Mandela, has died, according to the African National Congress on Monday. The South African Broadcasting Corporation says the 59-year-old who was serving as South Africa's ambassador to Denmark died in a hospital in Johannesburg. It did not specify a cause of her death. Zindzi Mandela, whose mother was anti-apartheid activist Winnie Madikizela-Mandela, rose to international prominence when she read out Nelson Mandela's rejection of then-President P.W. Botha's offer for freedom in 1985. The United States continues to be hard hit by the coronavirus. The U.S. had more than 60,000 new confirmed cases on Sunday as infections surge in many states, including Florida, Texas, Louisiana, and Arizona. Florida reported Sunday a 24-hour increase of over 15,000 new confirmed cases, shattering the previous one-day high for a U.S. state by more than 3,500. Surgeon General Jerome Adams, top U.S. health official, is urging everyone to wear a mask when out in public to prevent the spread of COVID-19, but he stopped short of saying there needs to be a nationwide mandate. Now to Africa, where South African President Cyril Ramaphosa announced a renewed ban on the sale of alcohol and a new nighttime curfew Sunday as the number of new coronavirus infections grows. South Africa has over 276,000 cases and slightly more than 4,000 deaths, according to Johns Hopkins University. With more than 3 million cases and over 137,000 deaths, COVID-19 is taking a heavy toll on the United States as the number of new infections continues to rise. As VOA's Ken Farabao reports, encouraging people to wear masks is becoming a widespread effort throughout the country that could help control the spread of the virus.
At Elkhart Lake, Wisconsin, fans of IndyCar racing gathered by the thousands for the first publicly accessible event since the coronavirus pandemic closed racetracks across the country. Masks were encouraged, but not mandatory.
Yeah, it's one of the best tracks in the world, so they're taking the precautions. Everyone else is taking precautions. I had no concerns about coming out.
All the staff and drivers and everybody are wearing masks, but I don't think the fans are quite as good about that.
In Florida, one of the states experiencing a surge in new COVID-19 cases, the popular Disney World resort opened its gates to visitors for the first time in months, with a mandatory mask-wearing policy for most areas of the theme parks.
To the data we have right now, there's no downside to wearing a mask.
U.S. Assistant Secretary for Health, Admiral Brett Giroir, emphasized masks could prevent further spread of the virus, especially in areas where COVID-19 is on the rise.
It's really essential to wear masks, and for this to work, we have to have like 90% of people wearing a mask in public in the hotspot areas. If we don't have that, we will not get control of the virus.
After weeks of resisting, President Donald Trump wore a mask publicly for the first time while visiting service members and healthcare workers at Walter Reed Army Medical Center in suburban Washington, D.C.
I think when you're in a hospital, especially in that particular setting where you're talking to a lot of soldiers and people that in some cases just got off the operating tables, I think it's a great thing to wear a mask. I've never been against masks, but I do believe they have a time and a place.
In an online question and answer session from 10 Downing Street in London, British Prime Minister Boris Johnson hinted at tougher restrictions throughout Britain as new legislation in Scotland made masks mandatory in shops.
But face coverings, yes, we increasingly think that we've got to be very insistent on, in places, in confined places, where you're meeting people that you don't normally come into contact with, transport, shops, wear a face covering.
Medical experts say wearing a mask isn't the only important measure that could stop the spread of infection.
You really got to stop the bars you've got to decrease restaurant capacity, you've got to physically distance. We have to have people wearing a mask in public. It's absolutely essential, and you've got to use good hand hygiene.
Measures Admiral Gerard and other health officials across the United States hope will curb infections in the country that set records for the most new COVID-19 cases in a single day, several times over the last week. Kane Fairbaugh, VOA News.
You're required to wear a face mask in City West Hollywood.
The White House has formally notified the United Nations that the U.S. plans to withdraw from the World Health Organization, a decision that continues to be widely criticized by global health experts. One Campaign, a global movement working to end extreme poverty and preventable diseases by 2030, says withdrawing from the WHO puts the safety of millions of people, especially those in the developing world, at risk. One Campaign CEO Gail Smith tells VOA's Jackson Vunganyi that the U.S. government should provide more funding for a global pandemic response package to help strengthen global health systems and ensure equitable access to an eventual COVID-19 vaccine.
I think there's a huge cost to the international community because we need the WHO, again, as a body that helps coordinate, make sure information is coming in and coming out to everybody. It's a provider of assistance that many countries rely on, absolutely. It provides international guidance. And it does things other than the coronavirus. I mean, think about the effort to wipe out polio. There are a number of other things WHO does. So I think the implications are very negative, quite frankly, for the global response, but also for the United States.
During this COVID-19 global pandemic, we know one of the things that have been adversely affected has been the economies, global economies, including here the US, in many African countries. We know that lots of public health programs on the continent depend on funding coming from the US, from other European partner countries, and that they talk that given that these countries are already suffering themselves economically, that they're going to reduce some of their foreign aid, or the funding that they give to these countries. What are some of the dangers in contracting or in reducing foreign aid, especially to the public health sector?
If you look at the gains of the last 25 years in Africa, both at the macroeconomic level, but particularly in public health, to take money away from that investment to either put it exclusively into the pandemic or to save money at home is to go backwards. And the fact is the international community needs to sustain those investments in public health, as do African and other governments, while at the same time responding to the pandemic. Now, we've had a couple of good signs. The replenishment, the multi-year funding for the Global Fund for AIDS, TB, and Malaria, and the Global Vaccine Alliance both surpassed their targets, right? So that's a good sign. I think the danger is, as you suggest, that because of the economic pressure at home, donors will start to step back. And at one level, you can understand that, but that's a very expensive proposition, because part of what the fight for ending this pandemic is about is protecting the progress that's been made over the last couple of decades. And it would be real folly to let that erode.
I did want to speak on that frustration. There's a lot of frustration going around. As a person who's working in this space, yeah. What are some of your frustrations?
Look, my frustration is that we know how to fight back against this, right? I mean, look what happened in West Africa during the Ebola epidemic. 3 countries ravaged by decades of war, supported by a lot of countries, but nonetheless, they pushed back and defeated an Ebola epidemic. So certainly the world can defeat this pandemic, but I think there's a lot of misinformation. There's a lot of discounting of science and scientific fact. There's more competition for things like PPE and medical supplies than there is collaboration to make sure that enough gets to everybody quickly enough. So I guess my frustration is that this is a big, costly problem for the whole world. We know how to solve it. We're not focused on solving it the way we should be. So we're extending the life of the pandemic, and I think the suffering for everyone is affected.
That was VOA's Jackson Vunganyi speaking with One Campaign CEO Gail Smith. The ongoing coronavirus pandemic has caused more than 500,000 deaths worldwide. What isn't included is the impact on the health of mothers, newborns, young children, and adolescents. Because of the pandemic, healthcare for women and children has been cut by 20%, and the result is rising death rates and poorer health in these groups. Here's VOA's Carol Pearson.
It's nighttime in Nairobi, and a pregnant woman is in labor. An ambulance service started by health workers takes her to the hospital. When the government imposed a curfew to contain the coronavirus pandemic, doctors noticed an increase in deaths of women giving birth alone at home. So they moved into action to save women's lives.
Maternity-related cases has gone higher. On average, we're doing 2 calls per night.
What's happening in Nairobi is happening worldwide, even in rich countries. A UN report shows that health services are being taken away from women, children under the age of 5, and adolescents in order to fight the coronavirus pandemic. The consequences are devastating.
Initial estimates are projecting that we're going to see major impact on under 5 mortality rates for newborns, for maternal mortality, the numbers of malnourished children, children who are exposed to abuse and violence, critical loss of access to women's health, etc. So the estimates are quite dire.
The report estimates that nearly 400 million children are going hungry because they're missing meals at schools that are closed. 13 million children are missing vaccinations. Some parents are afraid to take their children to get their shots, and some countries have a shortage of vaccines.
The risk of a new and renewed outbreak of measles, polio, and all these other infectious diseases is actually real, and it's something that we need to be prepared for.
The report also finds that women and girls worldwide are experiencing higher rates of abuse, increased pregnancies, less access to reproductive services, and along with that, more mothers are dying from complications of childbirth. Dr. Ali Pui says a vaccine, once developed, will end the COVID-19 crisis. But rich countries, he says, will have to help the poorer countries strengthen their health systems, because the pandemic will leave the poor even more destitute than before. Carol Pearson, VOA News, Washington.
As Sudan goes through its 3rd month of COVID-19 lockdown, a new trend is growing in Khartoum as people turn to home gardening to stay productive and healthy. Alamin Jafar's Facebook group, which helps people share home gardening ideas, has seen its membership grow 7-fold during the pandemic to 350,000 followers. Naba Muhyiddin reports from Khartoum.
Alamin Jafar, an information technology engineer in Khartoum, has found his passion in agriculture. Through his Facebook group, Jafar is encouraging people to garden at home to stay productive and healthy. The Facebook group, called Aziwi As-Sudani, or a skilled Sudanese farmer in Arabic, helps people grow their own food.
Information about agriculture should be available for free to help people garden at home. Without the information, people will not know how to garden in an efficient and cost-effective way. People are already growing and farming to reduce the consumption fees. Without the information, they'll prefer buying from the market, despite the issues of the non-organic products.
The Facebook group's membership has grown 7-fold during the pandemic to about 350,000 followers. With the help of experts and his own family, Jafar is gathering and delivering the best seeds available to motivate beginners to get started. Since the lockdown, gardening shops have become more popular, giving customers more plant options. Shop owners say fruit saplings and aloe vera plants are the most popular. Group member Faris Karor began planting flowers and aloe vera. Now he's growing vegetables too.
I was using the roof to plant shadow plants and normal flowers. After the quarantine started and the popularity of Zindzi Mandela group, it was so useful to me. I changed the roof spaces to other agricultural products like vegetables. I have already harvested them now.
Experts say the home agriculture trend is helping people deal with issues related to the pandemic.
People who are practicing agriculture and are interested in it feel more relief from the stress and tension due to the coronavirus. It is also increasing the feeling of security as people are having agriculture products being produced in their homes.
Sudanese authorities recently loosened lockdown measures meant to control the virus. It's unclear if the home gardening trend will continue to grow. Naba Muhyiddin for VOA News, Khartoum.
We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Coming up, the horse racing annual Gold Cup bows to coronavirus restriction and takes place without spectators just outside Washington, D.C. We'll be right back.
Hello, I'm Lina Ormoudou, your VOA Health correspondent. During the COVID-19 pandemic, the World Health Organization says there are currently no drugs licensed for the treatment or prevention of COVID-19, and there is no proof that hydroxychloroquine or any other drug can cure or prevent coronavirus. The misuse of hydroxychloroquine can cause serious side effects, illness, and even lead to death. For more information on COVID-19, visit who.int or contact your local or national health authorities.
Welcome back to Africa 54. The United Nations Food Agency has released its 2020 State of Food Security and Nutrition in the World report. It contains the most recent estimates of hunger, food insecurity, and malnutrition around the world. International edition host Steve Miller spoke with Cindy Holman, senior economist at the UN's Food and Agriculture Organization and lead author, about the latest estimates and what needs to be done to help the world's 690 million undernourished or hungry people.
The key finding of the report is that this year we're seeing that the number of hungry, or the chronic undernourished, as we call them, is continuing to go up. So if we look at 2019, 10 million more people in the world have now fallen into that category of being hungry. If we look at the last 5 years, it's 60 million. So the key message is that the trend is not good. We've done a whole new estimation with new data and improved data from the countries. And this message is still confirmed and reconfirmed that we're heading in the wrong direction.
In terms of heading in the wrong direction, what does that do towards goals to eliminating hunger as a whole?
Right now, we're moving in the wrong direction. Instead of decreasing hunger for the last 5 years, we've seen hunger numbers steadily increase. It's not like we're just slowing down. We're moving in the opposite direction. They're increasing. And also what we've done in this report this year is we've done some estimations and projections up to 2030 to see, how far off track we are. And what it shows is that by 2030, we could be at 840 million people that are undernourished. And that's actually the highest since 2004. So it means that we're wiping away our gains that we've made in the last 15, 18, 20 years.
Based on your research, what's contributing to that?
For the last 3 years, we've looked in depth at 3 areas that it's driving this trend of increasing hunger. The first one we looked at was conflict. And in many parts of the world, conflicts are becoming more complex, contracted, and that is contributing to chronic hunger. The other element is climate, increasing climate variability and extremes, changes in seasons, which is creating problems of people's income, but also access to food. Last year, we also focused on economic slowdowns. The impact that COVID is another shock now, and it's a tremendous shock that's having an impact globally, this pandemic. You also have disruptions in supply chains. So all of these factors contribute to also increases in hunger.
I wanted to ask you about that because we've been talking about, a macro global effects of hunger, but if we drill down to the African continent, what are the main concerns there? By
the end of 2030, Africa can become the place where not only has the highest prevalence or the proportion, but the highest number globally. So that's quite alarming in a geographic shift that we're seeing by 2030. And again, it's a combination of factors. It's the conflict, it's the climate, it's the economic. There is some good news coming out in terms of, some of the economic growth in the countries and the development that's happening. However, the challenges are huge. So yes, Africa is one of the regions that we're especially concerned about. But the other focus of this report, what we're highlighting, that's really important, it's also important for Africa, is the issue is it's not enough to have just enough food. It's about having healthy, nutritious food. And, our estimates are that 3 billion people around the world cannot afford a nutritious diet. And if we look at Africa and South Asia, about 57% of the population there cannot even afford a healthy diet. So this has big implications. And I think, why is it important to have a healthy diet? Because it's actually linked to food insecurity as well as malnutrition. So we see that the affordability, if a diet is not affordable that's nutritious, we see higher rates of child stunting, we see higher rates of undernourishment, but also we see overweight and obesity because there's multiple forms of malnutrition. So, not being able to have enough money to afford the cost of a nutritious diet is an important factor that is also driving these problems around hunger and malnutrition.
That was International Edition Steve Miller speaking with Cindy Holman, FAO senior economist and lead author of the agency's 2020 report on the state of food security and nutrition in the world. Google's parent company Alphabet has officially launched its balloon-based internet service in Kenya. The transmitters float high in the atmosphere and are believed to be a world first for consumers. Tom Skelly has the details.
Hello, Your Excellency. Yes, I can see you.
President Uhuru Kenyatta is getting a video call from a remote part of Kenya's Rift Valley. Something made possible by the launch of a world first in commercial internet. In Baringo on Wednesday, Google parent company Alphabet launched high-speed internet provided by balloons. Yes, balloons. Really high-flying balloons soaring higher than planes, hoisting powerful transmitters similar to a cell phone tower. It allows people in the remote regions below to get high-speed internet through a partnership with Telkom Kenya. The technology has been used before to connect more than 250,000 people in Puerto Rico after a 2017 hurricane. But Kenya's Information Minister Joe Mucheru says this is the first commercial application.
We want the rest of Africa to join us, creating a single digital market so that, our 1.3 billion Africans can also all be connected.
The balloons are launched from facilities in California and Puerto Rico and use artificial intelligence to navigate flight paths without much human intervention. For residents in Baringo, the long flight of the balloons means they no longer have to trek more than 40 miles to the nearest towns for an internet connection. Dorcas Kipkaroy says she wants to sell her jars of honey to expatriate Kenyans longing for a taste of home.
This will help me reach out to people, even in the diaspora, because it has been really hard due to poor network around here.
Loon has a deal to roll out the service in Mozambique, and Chief Executive Alistair Westgarth says there's been an increased interest from operators and governments after lockdown measures forced people to rely on the internet more heavily.
In our sports news, many sports events, including horse racing, have been cancelled or postponed due to the coronavirus pandemic. One of them was the annual Gold Cup steeplechase in the Plains, Virginia, outside Washington. But instead of dropping the entire event, the organizers decided to hold the race without spectators. As we hear from VOA's Deborah Block, this year's Gold Cup was offered virtually to anyone who wanted to watch it.
And they're off and running.
Here at the Great Meadow Race Course in Virginia, the Gold Cup is one of America's premier steeplechase horse races, drawing large crowds. Normally, tailgaters party and wear fancy hats. But for the first time in its 95-year history, the event was live-streamed for free and without the usual cheering onlookers.
The Holy One right on the outside.
There was a sort of an eeriness as we're watching the races when they would pass the grandstand, and the grandstand was empty. And there's at Gold Cup, we have 50, 60,000 people come. The roar of the crowd at the finish is just something that's part and parcel to every experience I've had.
Even live-streamed, the steeplechase races were exciting to watch.
Some are over hurdles or like simulated brush jumps. Others are over stiffer jumps, timber jumps. So these horses are jumping a significant height at speed. So they're doing 30 miles an hour and jumping at the same time.
Julie Gomina, who trained several horses that ran in the races, amidst the enthusiasm of the crowd.
It is very strange feeling to not have people around.
Gomina has a passion for training the thoroughbred horses, which are known for their strength, speed, and athleticism.
They're all different, figuring the individuals out, different personalities, different traits, different quirks.
Jockey Ross Garrity, who was in several races, says he doesn't pay attention to the crowd. Since his focus is on winning, he says, not having spectators this year did not make any difference to him.
When I'm on the race course, I'm concentrating on what I'm doing, and that's my focus.
Ross Garrity has gone to the front with Balance the Budget. That's his running style.
The 43-year-old has been a steeplechase jockey since he was 17 years old.
It's a huge thrill. There's a huge rush involved.
Steeplechase racing can be dangerous, he admits, and says he has been fortunate not to have gotten injuries that could have ended his career.
At the fence, it'll be Balance the Budget there first.
There's the risk of falling or stumbling at the back of the jump. People don't really realize horses will do everything not to step on you or hit you.
Gomina hopes more people were able to appreciate the steeplechase by watching the Virginia Gold Cup live streamed.
Horse racing is so much fun, and to see the beauty of it, the athletic ability of the horses, there's nothing like it.
Deborah Block, VOA News, The Plains, Virginia.
Might have a slight advantage.
And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thank you for watching.